Okay, today I'm really excited to have my Aunt Cinda here. We're going to do the ultimate mommy makeover. She is the mom of 6 kids. We're going to be doing the full face, Botox in the middle. We're going to be treating under her eyes, her cheeks, down around her mouth, and the jowl area. Starting with underneath her eyes with a product called Volbella. Okay. Her face has been prepped and numbed. And also a little side note, this is the first time she's ever had any procedures done, and so a little nervous, but she's going to do great. I'm going to just do a little volume restoration under her eyes and start to lessen that look of a tired, drawn down eye. Here's a little poke. So ever so carefully, I'm just going in right at the orbital ridge, carefully doing some volumizing. It's always best to do a little under than put too much product in and then it creating a, kind of like a water bag. So product choice is also important in this area. We want a product that is very forgiving and a product that is not very hydrophilic. Hydrophilic meaning that it attracts water, so we do not want to attract a bunch of water. So Volbella, and it's from the makers of Juvederm family, and it's a great product for underneath the eyes. So slowly and carefully, here's a poke. After I do the injection, I like to immediately hold pressure because if anything's bleeding, we want to stop that. I don't want you walking around with a little shiner. For each eye, I'm going to be doing just shy of a half a syringe or 0.5 mLs. And that's pretty typical for a tear trough area. You do want somebody very skilled in injectables if you're choosing to do this treatment. There's a lot of vessels and nerves, tear ducts, all kinds of different things that your injector needs to be mindful of. So it's definitely not a novice area. Already looking really good. And how are you doing? Great. Okay. It's a very comfortable procedure. There's lidocaine in the syringe and she's had the topical numbing as well. It's not very painful. And that looks pretty good. So now I'm going to continue on with her cheek, and the product that I'm using is called Voluma. So Voluma is like your classic volumizer. I call it the cake. So we just did a little frosting, and then we're going to put a little cake underneath it. Here's a poke. And I'm restoring the Malar fat pad and tying it into the filler that I just did under the orbital ridge. And then bringing the product up and connecting it to the cheekbone. And I like to do it in 2 different areas, so as to create like a basket weave underneath her cheek. So that's like the first threads, and then I'm going to do a secondary poke this way and tie it all in together. You're going to get a more natural appearance to the cheek, and also it's going to help retain some of the longevity. Already looking pretty good. Okay, I'm going to finish up with the Voluma and taking this at a little bit different angle. Here's For the typical treatment of underneath the eyes and in the cheek, longevity with Voluma, it's about a year, once a year procedure. So here we already have underneath the eyes accomplished and the cheek. Next we're going to start around the mouth and also down here at what we call that classic marionette and jowl area. I'm going to strengthen up her jawline and sort of minimize the look of the jowl, and then also treat the little vertical lip lines. Sound good? So the product that I'm using around the mouth is called Vollure. So this is a new product that Allergan has just launched. Here's a poke. And it goes in real smooth. All these products too, lower incident of extreme swelling. So it's like the new generation of fillers. So Vollure just got FDA approved this year, and it's going to be great for areas like around the mouth and like this jawline area. Here's a poke. So I'm just strengthening the jawline, adding some restoration. A little bit more. Product choice is really important. So if you end up using a product in the wrong area, you're going to compromise the longevity of it, and you're going to compromise the results. So product placement is really imperative. And a little bit more here. And last but not least, I'm going to go back with a little bit of the Volbella, the same product I used underneath the eyes, and I'm going to target a little bit of these little micro lip lines. And just like that, the mommy makeover. We'll do her Botox at the end. Okay, so save this one for last because this is a little bit of a doozy, but this is quite the poke here. Here it is. Just strengthen that up a smidge. And now I'm going to go this way. You got great lips. You got that perfect little classic Cupid's bow. Doing pretty good for never having any treatments.
So far, so good.
Yeah. And pain level, like from 0 to 10, 10 being the worst, what would you say the pain?
I mean, so minimal.
I know,
it's
isn't that
like
nice?
nothing. It's so easy.
Thank goodness for a little bit of I'm going to do one more little poke right here in this corner. I feel like we need a little extra right here. With the lidocaine and the syringes and the topical numbing, it really makes it for a comfortable procedure. Here's a little poke. Of course, got to get a little Botox in there. Here's a poke. And the mama of 6 kids is going to be looking pretty dang smoking hot. Okay. She'll have about 3 to 4 days of swelling, and obviously there, could possibly bruise, but here's the gauze I've been holding, so this isn't a big bloody event. in about 3 weeks will yield the final result. So with fillers, the best process is if you layer up slowly, so it is a chance that she might need more. Okay. All right, you can go ahead and open your eyes. Might feel just a little weird because there's lidocaine underneath your eyes, and so that kind of makes it sometimes feel a little weird.
Feels fine.
Oh my gosh.
Can you see?
Yeah, I'm going to show you. I'm going to show you the difference. It's so fun. Okay, so this is the big reveal for Cinda, and this is immediately after we have done this side. Okay, so again, results are going to be subtle. So there's.
Wow.
Okay.
Oh, I can already tell the difference.
So here's underneath these.
Yeah.
There's that. Okay.
Mm-hmm.
And then here's the split in the cheek on this side.
Wow.
Here it's restored. Here's the jawline strengthened here. And there's the indent. A little bit volume restoration there, and then softened up those lines.
Oh,
Yeah.
wow. That is already amazing.
Isn't that cool?
Thank you. I love it.
That looks great. Okay, so now we're going to do the second side, and go ahead and keep your eyes closed. Stay nice and still. Here's the first poke. So some Volbella underneath the eyes. So Cinda is still a working mama, so she works outside the home as well as inside. And so this is going to help her compete with the younger gals in her workforce. And if I haven't said it already, this is the first time she's ever had fillers or Botox, so she's doing great. But it's never too late. And the cost for volume restoration, it depends on what product you're using and how much you have to use, but annually it's about anywhere from $3,000 to $5,000. Now I'm going to start with the cheek, and again this is Voluma that we're using. I like the product to go in like threads. I don't like to just bolus a big ball of product. I want it to be put in there like threads so it attaches to the cheekbones and giving that uplift. Okay, I'm going to change the angle. Here's a poke. We also have some subtle differences between right and left. And so it's important that your injector is mindful of that. Sometimes the side that you sleep on will need more product, or if you have a dominant side related to muscle strength. Little hole right here that needs to be addressed. Here's a poke. Okay, so under the eyes and the cheeks now, we've got good symmetry. And you can see what I'm doing. Not only am I holding, I'm doing a little bit of molding on the product. It's very malleable, very forgiving, and just making sure we've got proper depth and that things feel real smooth underneath the skin. So. Okay, now we're going to finish off with the Vollure like we did on the other side. Here we go. Your skin's doing really good. Okay, all right. Poke. Doing a little support in the corners. As we age, our corners start to turn down and start to give the appearance of frowning. And so we're going to support all that. And then also back to this jawline, we want to strengthen this jawline up and minimize the appearance of the jowl. The products that we have on the market these days are very safe. The incident of anything adverse like allergic reaction or infection is just so minimal. Very low risk if you're going to somebody that has a lot of experience. All right, and last but not least, I'm going to do just a little poke up there. Teeny little line. Here's a poke. And here we go, the official mommy makeover, mama of 6. First time gets to think about herself. Yay! Good job.
Very good.
I know.
So what do you think?
Isn't that
Much
cool?
of it? Hold that up there.
Okay.
What do you think? Much of a difference there?
Oh, I'd say amazing. It's a huge difference.
Yeah.
Like night and day.
I know, and we forget, because like when we see yourself in the mirror, you go, I remember this person. And you don't, you kind of quickly forget this person.
Oh,